Okay, assalamu alaikum guys, welcome back to my YouTube channel phaRmacoloGy. I hope that you all are doing good and well. So today your watch is over and we are here with another new topic of the pharmacology, which is the antileptics. So let's start. What are the antileptics? What is epilepsy? A neurological disorder marked by sudden recurrent episodes of the sensory disturbance, loss of consciousness and conveyance, and it is due to the abnormally high level of excitatory glutamate, abnormally low level of the inhibitory GABA, abnormal electrical properties of the affected cells. Epilepsy is a disorder characterized by the recurring seizures known as seizure disorders, and a seizure is a brief temporary disturbance in the electrical activity of the brain. Its causes are trauma, infections, head injury, stroke, metabolic disorders, hypoglycemia, antidepressants, overdoses, lead carbon monoxides, poisons, genetic factors including brain tumors and meningitis. Classification of the seizures are the partial seizures and the generalized seizures. Partial seizures are the simple seizures, complex partial seizures, secondarily generalized seizures, and the generalized seizures are the absent seizures, myoclonic seizures, atonic, tonic, clonic seizures, and febrile seizures. So the simple partial seizures are the normal consciousness, remain localized, involve involuntary muscle contraction, effect on the mood and the behavior. Complex partials are the localized onset but spread towards the brainstem reticular formation, arise from the temporal and the frontal lobe. And secondarily generalized seizures are the burst of electrical activity in a limited area throughout the brain and precedes generalized tonic-clonic seizures. Primary generalized seizures includes absence seizures, which are brief period of the unconsciousness, last for 10 to 45 minutes. Myoclonic seizures are short episodes of the muscle contraction for several minutes as a result of the permanent neurological damage. Atonic seizures are the drop attacks, sudden loss of the postural tone, eyelids may droop, head may nod, and the person often falls to the ground, remain conscious. Tonic-clonic seizures are the tonic rigidity of the all extremities with involuntary cry, and defecation and micturition is involving a tongue and cheek may be bitten. Bloody saliva. Antileptic drugs characterized by the mechanism of action are the sodium channel blockers, phenotines, carba, mazepine, regine, zonisamide. Calcium channel blockers are the topiramate, lamotrigine, ethosuximide. Glutamate receptor antagonists are the topiramate and the phalbamate. GABA receptors are the benzodiazepines. Phenobarbital and potassium channels are the retigabines. Okay, sodium channel blockers bind preferentially to the inactivated state, prevent the return of the channels to the active state by stabilizing the inactive form and presynaptic and the postsynaptic blockage. This one is the diagram of the enhanced sodium channel inactivation. For the calcium channel blockers, low voltage calcium currents T types are responsible for the rhythmic thalamocortical discharge spike and wave patterns for the generalized absence seizures. Some antileptic drugs block these channels, inhibiting underlying slow depolarization necessary to generate spike wave burst. This one is the diagram of the calcium channel T type. For the GABA enhancers are the GABA agonist bind to the GABA A receptors, enhances caloric influx, hyperpolarization of the cells, enhanced inhibition. Uptake blocker block presynaptic GABA uptake by blocking GAD1 transporter, and the GABA T inhibitors are inhibit the metabolism of the GABA and the GABA transaminase. This one is the diagram of the GABA enhancers. Further, we have the glutamate blockers, which are some NMDA site, kinase site, and AMPS site. This one is the diagram of the glutamate blockers. Phenotine and phosphonotine given orally and IV. And its adverse effects are it produces cardiac arrhythmia, hyperplasia, coarsening of the facial features, and impaired brainstem and cerebral functions, nystagmus, double VN, cognitive impairment, so many other things. Carbamazepine enhances the inactivation of the sodium channels, can produce voltage use and time dependent. It is also used in the trigeminal neuralgia and manic depressive patients, and adverse effects are the drowsiness, vertigo, allergic reactions, fever, restoration, urinary retention. Ethosuximide inhibit the T-type calcium channel, reducing low threshold calcium currents used in absence seizures, and adverse effects are the dizziness, lethargy, euphoria, skin rashes, Benzodiazepines have IV diazepam and lorazepam. Generalized tonic-clonic status epilepticus and clorazepate dipotassium as adjunct in the complex partial seizures. So it's our video on the anti-epileptics. I hope that you understand it, and if you understand it, then go and like my video, subscribe my channel, and wait for the important videos of the pharmacology.